My name is Matt Blois. You're watching Medically Necessary, a show about the healthcare supply chain. I talk with experts, business leaders, and researchers about how we get drugs, devices, and medical supplies to healthcare providers and patients. This show is brought to you by Ryder, the only fully integrated logistics and transportation provider in the industry. Ryder solutions cover the entire supply chain, including warehousing, transportation logistics, e-commerce fulfillment, and last mile. Discover how Ryder can make you ever better at ryder.com. And today I'm talking with two leaders from Ryder about how we can use logistics to improve the patient experience. Gary Allen is Ryder's Vice President of Supply Chain Excellence, and Garrison White is Ryder's Senior Director of Continuous Improvement. So in the past, I feel like hospitals, administrators of health systems saw the supply chain as something that was primarily a cost, and the goal was basically to really reduce those costs as much as possible. However, I think more recently, administrators are starting to really see the supply chain as something that can add value to patient care and contribute, affects patient care and is involved in patient care. And the idea is basically, better supply chain decisions lead to better patient care. And so I brought Gary and Garrison on the show today to talk a little bit about how logistics providers can play a role in providing this kind of care. So let's start with Gary. Can you explain how supply chain management can overcome some common challenges in the healthcare supply chain?
Yeah, sounds good, Matt. First off, thank you for letting us participate today. Looking forward to the conversation on behalf of Ryder. Yeah, if you think about supply chain management, I mean, just the definition of that term, I mean, it starts with the flow of information, goods, services, right? And I think healthcare, and we'll talk about the healthcare supply chain, which is still rather immature in many ways, but it's about how do you link all the dots from source of supply through procurement, through planning, through manufacturing, logistics, and then ultimately to the end consumer. And in this case, it's the patient, right? And it's all about kind of that patient experience. And if you think of the healthcare supply chain, Ryder participates and services different nodes within that supply chain today. So we service healthcare providers, we're managing warehouse inventory, we're replenishing to hospitals, we are delivering, managing transportation for medical device providers, as well as dedicated transportation to pharmacies and the retail network. And it's a pretty complex supply chain. So while the healthcare supply chain is immature in many ways when you compare it to retail or tech or automotive, I would say the complexity with the healthcare system is significant, right? There's so many different layers between a hospital, a distributor, a GPO, to the patient. So it's the whole aspect of how do you link all those layers together. There's regulatory concerns, there's system integration challenges that have been going on. And to your point, Matt, that the focus of supply chain has typically been about procurement and cost. And it's shifting. It's shifting more towards different components, including what we do, which is logistics. So there's different ways that the healthcare providers can look at their supply chain. And it really starts with the first part, which is better planning. Historically, healthcare providers, hospitals, they haven't done a great job around planning across all the different nodes of the supply chain. They've done a good job on buying stuff and buying goods that go in and supplies into a hospital, as an example. But how do you plan across all those different layers is a very, very complex opportunity. The other piece is it's about the patient experience. So what are the hospitals measuring? What are the healthcare providers measuring? And that is changing, right? We're seeing a shift, and Garrison will talk about some of those core metrics, into how do they incent the providers to do the right things to make sure our experience is a great one. And that could be, visiting the hospital or a clinic and you're left without seeing, a doctor, as an example, or time to fill, how long are you actually, being serviced, right? So those are metrics that the hospitals and healthcare providers are starting to bring in. Another one that we'll talk about a little bit later is because of the layers. One of the biggest opportunities is how do you manage visibility of the flow of inventory across all those nodes, right? And how do you affect and minimize exceptions? And we'll kind of talk about that in a little bit later. And then a big one is data, and technology. It's not unique to healthcare, but I think it's even more complicated because of the nature of the supply chain. Is how do you manage that data, and how do you actually convert that into insights and information? And the last one is collaboration, right? It's like historically, a lot of healthcare systems have relied on, their distributor wholesaler. And the supply chain in healthcare is extremely complex. So how can you collaborate across the different nodes, different providers, including what we do on the logistics side?
Yeah. Well, and it sounds like I'm glad you ended on that note of collaboration, because I think that is sort of the common theme among a couple of the things you mentioned. Because there's you started off talking about the complexity and how there's normally if you're a retailer, you're it's a little bit less complex. You're delivering a product, a shirt, some electronic device to the person who's going to buy it, and sort of, did you do a good job or not. In healthcare, there's so many layers. There's the GPOs, there's the distributors, there's all of these different layers, and so it's a little bit less. There's a little bit less direct connection between the person who we're all ultimately supposed to be serving, which is the patient, and the people providing these services. And so, like you said, collaboration key. And then, the other thing you mentioned too was the data. And, I think that's the complexity also makes the data challenging, making sure that we have everybody, we're finding ways to sort of share the data that people need to see among all these different stakeholders. So I want to switch over. I want to ask Garrison a question now. I want to ask about, why healthcare needs value-based supply chain management. And maybe we could start off by just defining what exactly value-based supply chain management is, and then explain why that's something we need.
Yeah, certainly. Again, thank you for inviting us to this podcast. I want to start with really defining account care organizations, ACOs. So they're a group of doctors, hospitals, and other healthcare providers who come together to give a coordinated, high-quality care to their Medicare patients. The goal of coordinated care is to ensure that patients get the right care at the right time while avoiding unnecessary duplication of services and preventing medical errors. When an ACO succeeds in delivering high-quality care and spending healthcare dollars wisely, the ACO will share in that savings it achieves for the Medicare program. ACOs seek to optimize inpatient utilization with the most cost and quality effective tools for delivery of care. Centers for Medicare and Medicaid Services incentivize shared savings via pay per value. Based on safe and quality outcomes, optimized resource utilization, electronically tracking of patient care, and while providing a greater level of cost transparency. At Ryder, our supply chain services enable ACOs to better achieve their value-based incentives, therefore the term value-based supply chain management.
Yeah. Well, and I think that's a term. I feel like if a lot of our listeners are involved in healthcare, and they're probably somewhat familiar with this idea of value-based care, essentially just sort of paying hospitals based on patient outcomes rather than sort of fee for service. And so it's interesting, at the top of the show, I talked about sort of, how supply chain can affect patient outcomes and affect patient care. And so I think it's maybe not, when you hear terms like value-based care, you might, at least if you're sort of at the provider level, maybe your mind doesn't immediately jump to the supply chain. But I think what you're arguing is that maybe it should, or supply chain's a part of that, and supply chain's a part of sort of meeting those goals and meeting those, responding to those incentives that are out there.
Yeah, certainly. There's a whole variety of metrics that these ACOs are trying to achieve, and we're coordinating our services to identify which ones of our services best apply to their metrics and really help solve that problem. And we're pretty excited about that.
Yeah, that totally makes sense. So I want to go back to Gary, and this goes back to something you mentioned in that initial answer. I want to talk about visibility. So how can supply chain management provide visibility or transparency or traceability within the healthcare supply chain, and why is that something that's important?
Yeah, visibility is not a new topic or challenge that's out there. I think what's unique in the healthcare supply chain, as we mentioned earlier, is just all the different layers and the different entities just add so much complexity. But the way I look at visibility, I prefer to call it transparency, and it kind of fits the healthcare industry, right? Around chain of custody and being able to not only see what's going on, it's more about the context of who's doing what and why. And when exceptions occur across the supply chain, what do you do about that, right? I mean, if you think about visibility, you really can't improve something if you can't see it and you can't manage it. And one of the key inputs is you have to have the data, right? Whether it's tracking inventory of supplies in a warehouse, whether it's tracking inbound shipments or delivery to a hospital or delivery to a retailer, what's critical is that each entity in the supply chain, they need to know when something's going to arrive, and if it doesn't arrive, what do you do, right? So if I don't have enough supplies for a certain procedure, or if I don't have supplies to service, a pharmacy, because it's all about, that aspect of the experience of a patient or a customer, right? And if they don't have what they need at that time of an activity, a procedure, an operation, or even if I go to buy something, it's going to be a horrible experience and I'm not going to want to go back. And so we view visibility or, supply chain transparency as a critical enabler to be able to make sure that you sync the supply chain together. And a key element of that is you need to understand what data and information you need to track and why and who's doing what, because ultimately it's about proactive supply chain management, right? It's not only pulling up, oh, I can see a shipment, right? Because everybody's got an app to track stuff nowadays. It's more about making sure you have the right inventory at the right level to service your end customer. And if a disruption occurs, you mitigate it earlier on to get more towards predicting if I'm going to have a failure in my supply chain that affects the customer experience. And within Rider, we rolled out a product called Rider Share, and that's exactly what it does. It's more than visibility. It's that transparency and it's that proactive exception management, and allows our customers to kind of proactively manage their supply chain. So our view is the visibility transparency is a key enabler of an efficient healthcare supply chain.
Yeah. Well, and I think that's a good example of, you mentioned sort of planning ahead and if you have the data, that's going to help you plan ahead. And I think the other thing I think about with the supply chain in terms of data is, some of these supply chains are very long and very global. And so sometimes the disruption is happening on a different continent months ahead of time. And if you know that, the further ahead of time that you know that as a provider or anybody in the supply chain, as a GPO or a distributor, the more you can sort of take steps to mitigate that and make sure that it doesn't disrupt any patient care. But the complexity and the size of those supply chains, the length of them, obviously makes that tough to do.
That's right. It's a very complex supply chain, but I will say this, Matt, that the technology is getting better, cheaper, right? And so whether that's IoT, whether it's RFID, whether it's tracking inventory, the key is, being able to connect into all of your supply chain participants, right? And be able to proactively track inventory, but it's not only inventory, it's shipment and information around kind of that end consumer experience.
Yeah. Well, and I think you at some point you said visibility is not exactly a new idea, but I think over the course of the pandemic, it's really been highlighted as something that's so valuable, and people really see the value now, maybe more than they did before. Garrison, I want to go back to you with another question. So, what can supply chain management bring as a value solution to healthcare via BI and automation? And then maybe before you answer that question, maybe let's define the terms in there. What's a value solution? What's BI? What's automation in this context?
Yeah, I'll get through that. Right, I want to give you something that's very exciting, kind of a big find we have here, in that in 2017 survey by Cardinal Health reflects that 78% of responders were manually counting inventory, while only 17% had implemented any type of automated technology to store, sequence, track, or count inventory in real time. In the same survey, more than half the responders stated that the lack or missing of a product had interfered with patient care, right?
Can I interrupt you just quickly? Are these respondents healthcare providers? Is that who they were surveying?
Yes, they are. Yep, exactly right. Exactly right. Supply chain are disrupting, patient care, unfortunately, right? It's critical that that not happen, right? Of all places. So automated and technology-based supply chains can improve patient outcomes by improving efficiency and effectiveness. It allows to see proactively where certain supply items are within the healthcare system, coupled with a process to select and coordinate the delivery to the point of use with the patient. Technology integrates into various information systems, their clinical, administrative staff, and it gives them a bird's eye view of their operations with the ability to optimize processes through supply chain analytics and business intelligence, also what we know as BI, right? And then executives in hospitals recognize that their inability to make informed decisions due to the lack of access to advanced real-time reports. As mentioned earlier in an earlier answer, one of the reasons for this lack of data is that supply chains have been very fragmented and non-transparent due to the inherited internal structures in their supply chain in their healthcare systems. Now, Ryder brings integrated information technology such as Ryder Share, which Gary just mentioned, as well as Ryder OpsBox as a dynamic visual dashboard and reports enhancing the timely business intelligence to support decision making. Also on the automation robotics front, we're integrating with those folks and with the latest warehouse technologies such as AutoStore that provides high storage density while ensuring productivity. This coupled with what we do with detrashing, kitting, along with sequencing of totes. Now, this is really important. The sequencing of totes with specific timing to the internal routes on the hospital, right? By floor, by closet. So we're sequencing those so that we have an optimal route within a hospital and really we're picking to the closet, right, on the floor of the hospital. So that's very, very important, very unique in what we're doing now. Yep.
Yeah, getting down to the nitty gritty there, trying to optimize the efficiency closet to closet. But it matters. That makes sense. And I think this is going to lead right into another question I have for Gary, which is basically, Gary, I want to ask about how supply chain management can improve the financial performance of healthcare systems.
Yeah, I mean, just think about supply chain elements, right? I mean, it's a huge component of the financial picture around healthcare and if hospitals make money. I think it's what we talked about earlier, right? Around the account care organization. It's a shift from a pure cost focus to more of a value-based, or what we like to look at is more of a total cost to serve. And historically for a long time, logistics costs weren't necessarily a focus, right? It was more around procurement and inventory. And there's a lot of hidden costs around source of supply. And Matt, you mentioned around whether you're sourcing abroad or at home. The important element of balancing how much inventory to carry, where should my nodes of a network be located, because they're all connected in the end of the day. And I think healthcare providers and supply chain professionals are getting a little bit more sophisticated around, it's not just pure cost, right? It's around, how do you balance the optimal supply chain to understand and optimize how much inventory should I carry, what are my service levels, and the technology around that is getting far, far better, right? I mean, there's pretty sophisticated network modeling tools that you could do that, and it used to be for a long time that it was static, right? Financial reporting would happen monthly, and even from a network perspective, you look at how much you source and service levels. Now it's becoming much more dynamic where you're measuring these things in more days and weeks. You may not change your supply chain network in days or weeks, but you need to look at that picture around the decisions you make from every element from procurement to logistics, because they're all connected in the end of the day, but trying to correlate that into this total landed cost or total cost to serve. And then how does that affect the patient? And we talked about some of the new metrics that are going in place. But really the way we look at it, it's got to all be connected. You have to optimize, and you need to look at more of a broad total cost to serve versus just a pure cost metric.
Yeah, well, and I like that term total cost to serve because, correct me if I'm wrong, but kind of the way I'm understanding it as you're talking about it is, you know, one way to think about it is if you provide, well, I'll use the example of drug shortages because I know that's been a problem for decades. And one of the things hospitals will do if they run short of a drug is maybe they'll switch from option A to option B. Option B is it's going to work for the meantime, but it's not optimal. Maybe that means if you had used option A, the patient gets better, doesn't come back. You don't see that person again. Cost to serve is just option A. Use option B, maybe patient's coming back again. Then you're spending more to take care of this patient. It sounds. Am I understanding that right in terms of like what you're talking about?
You're right on with that example, and I think the challenge in the healthcare supply chain goes back to these silos and this fragmentation of all these different entities, right? So if I'm looking at an operation or I'm a nurse, right? Everybody is incented for different things, and people often don't look at how they all connect, right? And so part of it is how do you manage that data so you connect it, and then you frame each individual user or role across the healthcare so they understand those connection points, because people will look at what they have to do in a given day and they don't oftentimes think about how it's all connected, Matt.
Yeah, I think that makes a lot of sense. So Garrison, I think this is gonna be the last question for the show, but can you maybe explain to me how supply chain management would be able to improve the flow of patient care, and then maybe for listeners explain, what do we mean by flow of patient care?
Yeah, certainly, Matt, and thanks. So we've been touching on this quite a bit, right, in the previous answers, that patient flow is very complex. And the interaction between multiple systems designed to provide for healthcare and safety of the patient. If the processes and people are not able to cooperate seamlessly, then the treatment, handoffs, transactions are all ineffective and basically negatively affecting the care of the patient, right? Hence the flow of the care appears to the patient is fragmented or broken. Workflows must be effective and efficient so that the staff have the ability to adapt the service to meet or exceed the needs of the patient during the course of service. Flow exists to the extent that value is added to the service during the patient's journey through what we call the continuum of care, with 6 clinical elements that just need to be right. Of course, we need the right resources to the right patient, ironically, all right, in the right environment, such as the surgery center or the treatment room, for the right reasons, with the right team, and of course, at the right time, every single time.
Yeah. Well, and it's interesting to think about some of those. I feel like the pandemic has shaken up some of those. Well, and these are ongoing trends, but shaking up some of those pieces of those 6 components you mentioned. I especially think about sort of the site of care and how there's been a trend moving from places like hospitals, really traditional sites of care, to more of these alternative sites of care, whether that's like some sort of outpatient center or your home, thinking about telehealth and how that affects logistics. And I mean, you got to think about how to sort of respond to all of those different situations. I think, and you got to plan it out. And if you have a plan, you're going to do a better job. Well, I think that's all we have time for. I think we're coming up to the end of the time. But I really want to thank you guys for coming on to the podcast. This has been super helpful. I really enjoyed listening to what you guys had to say and just getting your perspective on this. So Gary and Garrison, thanks so much for coming on the podcast.
Thank you, Matt. We appreciate it. Take care.
Yep. Well, and thanks everybody for watching. This has been Medically Necessary. You can catch the next episode on Thursday.
Thanks again to our sponsor, Ryder, for making this show possible. The coronavirus pandemic has changed many aspects of the healthcare supply chain, but Ryder is prepared to help customers respond to these changes by offering solutions through the full supply chain. Discover how Ryder can make you ever better at Ryder.com.